Marlies.
Hi, Maaza. How are you?
I'm okay. How are you doing?
I'm very well, thank you.
And we have Kavengo here, who I don't think I've ever met. Kavengo, welcome.
Hello.
You're on mute, Kavengo. We can't hear you. Can you hear us, Kavengo? You're on mute. We can't hear you.
Oh, okay. I was actually muted. Hi, Maaza. I think I've met you once during the Global Week of Action when you were making some presentation during the People's Assembly.
Oh, excellent. Yes, of course. Nice to see you again. If you don't mind, we'll give people a couple of minutes and then we'll do a quick round because I think this might be your first meeting, Kavengo. So
Sure, it is. Thank you.
Susan, welcome.
Hi everyone.
Hi, Susan. Oh, I've missed you. Where have you been? You've missed our last few meetings. Welcome back.
Thank you. It's been a bit of a busy time. I want to catch up on all the news. I'm sure there is some with the new variant.
Yes.
So yeah, I am interested in the meeting.
Excellent. Well, welcome back.
Thanks.
We'll just give people one more minute. Hi, everyone. Welcome. We'll just give people 1 minute before we get started. And Marlies, I know that Health Justice Initiative has been doing so much press and statements around the new variant. Can I put you on the spot just to give us an update on the things that you've been doing when we get started?
Sure.
Okay.
Notes.
That would be great. Hi, Joab. Joab is here.
Hey, good afternoon. It's Roderick here.
Hi, Roderick. Welcome. So it's
South
5.
Africa.
It's 5 after. I think we should just get started, but I know that there's at least one person here who is joining for their first time. So I would love us to do just a very quick round of intros. I'll start. I'm Maaza Seyoum. I'm with the African Alliance and also working to coordinate the work of the People's Vaccine Alliance in Africa. So that's me. And I'll just go with how I have you all on my screen. Roderick, I'll start with you.
Good afternoon once more. My name is Roderick. I'm working for Human Resource and Social Information Center in South Africa in the Limpopo province. We're doing 7 programs. Amongst them is the HIV/AIDS education, carrier information dissemination, leadership skills development, income generating activities, sports, arts and culture, and human rights. Thank you.
Excellent. Welcome, Roderick. I think it might be your first time as well. Belinda, I have you next.
Hello, good afternoon. My name is Belinda. I'm from Worcester in South Africa, about 117 km from Cape Town. I'm a community activist and I'm a co-chair or a chairperson of Poland Advisory Board, and our site is SADV. I'm also chairperson for the FAM Cruise site here in Worcester, and also ICTG member and a LADCAP member.
Great. Thank you, Belinda. Joab?
Hi, everyone. Sorry, I was struggling to go out of mute. My name is Joab. I'm with Christian Aid as the Pan-Africa Senior Advocacy Advisor. So leading our advocacy work in Africa, but we're working also with countries and we're doing specific COVID-19 advocacy in Sierra Leone, Kenya, Burundi, and Zimbabwe, sorry. Yeah.
Excellent. Thanks,
Yeah,
Joab.
and then we also starting to do some media engagements in Nigeria, possibly from next week. Yeah.
Excellent. Great. Thanks, Joab. Susan?
Hi, everyone. I'm Susan from Genderlinks. I'm the Gender and Governance Associates at Genderlinks, which is a Southern African-based NGO. We work on gender issues across all 16 of the SADC countries, and I'm here to represent the organization.
Thanks, Susan. Charles?
Hi, everyone. I'm Charles Abikemi. I'm a policy officer at the London School of Economics in the Department of Health Policy, working on the projects around promoting evidence-informed policy making for health systems in 5 countries on the continent. Happy to be here.
Great. Thanks, Charles. Kavengo?
Hi, everyone. My name is Kavengo Matundu. I work with the GCAP, that is Global Call to Action Against Poverty. I coordinate the work for this organization across Africa. And I'm happy to be here for the very first time. And I think I made a push to be here. So thank you, Maaza, for allowing it. Thank you.
Yes, you did, of course. And now, yes, I remember you were connected, yes, through the person who organized that large rally. So yes, thank you. Thank you. Welcome. Marlies.
Good afternoon, everyone. My name is Maaza Seyoum, and I'm talking to you from Cape Town in South Africa. I'm a researcher with the Health Justice Initiative. Thank you.
Excellent. Thanks, Marlies. And then I will probably, because I know people are very curious to get the lay of the land, I will probably start with you, Marlies, if that's okay. But I just want to give our friend Anand from Kenya an opportunity to intro himself. Anand, can you just intro yourself very briefly?
Yeah, sure. Sorry, just give me a sec.
Sorry, I put you on the spot right as you joined.
I don't know if you can even see me. It's probably very dark.
Yeah, no, we can see you.
Yeah, I'm calling in from Nairobi. I'm coordinating the COVID Kenya kind of initiative, which is now working with UN Verified. We'll be launching a campaign, but it's more about internal distribution and awareness of just working on complacency and rumors more than the international situation, but obviously they are connected.
Great, welcome. Thanks, Anand. So I know that there's a lot of curiosity about what's going on at the moment with the new variant, particularly for people in Southern Africa, and what that means for the work of the People's Vaccine Alliance and all of us more broadly. So I had put Marlies on the spot and asked, just because I know the Health Justice Initiative has been doing so much over the last week, has been great about getting press coverage and op-eds, et cetera, and getting this into the discourse from the African perspective. So Marlies, could you just give us a sense of from where your perspective things stand, and then we'll give other people an opportunity as well.
Thank you, Maaza. Yeah, it would be great to hear how people have been making sense of the last few days. People will recall that on Wednesday, a group of South African researchers had identified a new variant of COVID. This was partly as an explanation of the huge spikes that we've been seeing in South Africa's Gauteng province in the last few days. There'd been a doubling of numbers of COVID numbers. So Julio de Oliveira and his team had briefed our Minister of Health and then shared the data and what they had discovered. And that has led to a number of global responses. I think some of the most worrying has been the slapping of travel bans on countries, specifically global South countries, where the variant now called Omicron has been identified. And I think some of the main issues that we've been discussing at the Health Justice Initiative is the fact that we don't know much about Omicron. There's the science is still evolving, so there's a lot of panic and uncertainty, but there's a lot that still needs to be determined in the next few days, if not weeks. I think the second point is that there's been a particular focus on the global inequalities, and there's been a pushback by the global movement around narratives that have evolved around the fact that the variant has developed. I think there's some talk about it being attributed to African continent specifically, and because of vaccine hesitancy on the continent, and that is the fault of African people, without any mention of the fact that there's been such huge problems with vaccine supply, and that it's not by far an issue of vaccine hesitancy, but because of the drip feed of vaccines, where it doesn't seem as if we'll be able to have at least 6 or 7% of people on the African continent with one vaccine at least by the end of the year. And then the third point that we've been talking about is the irrationality of travel bans, and how absolutely essential it is that evidence-based responses should be taken, and that this is absolute need for global solidarity. As not ever before. So I think that, and then the MC12 meeting that a lot of global activists have been gearing up for, the discussion of the TRIPS waiver. Some of the activists decided not to participate on Monday night when it was clear that some would not get visas or entry into Switzerland. The meeting was subsequently cancelled. And I think some of the discussion there is how the TRIPS waiver needs to go through despite a meeting, and that a decision is absolutely vital at this point. So I'm going to stop there, Maaza, and I would love to hear what other people's perspectives have been.
That is super helpful. Thank you, Marlies. And just for people who were not up to speed on the MC12, that's the ministerial meeting that's before the World Trade Organization Summit, right? That was supposed to be today, November 30th till December 3rd. And there was a lot of talk about using that as an opportunity to push the TRIPS waiver. But as Health Justice Initiative has said, the People's Vaccine Alliance is also insisting that there's no need for a meeting to approve the TRIPS waiver. So please, World Trade Organization, do not use the fact that the ministerial meeting has been postponed to now say that the TRIPS waiver can't be pushed through. So thank you, Marlies, for that, and for sending the article in as well. I see you've put a summary into the chat. Thank you so much. And for those of you who don't follow the Health Justice Initiative on Twitter, I would encourage it. A lot of the media stuff that Fatima Hassan in particular, and all the work that they've been doing, is very much on their Twitter account. And there's been a whole host of media interviews and statements and op-eds in the last few days. One question we've lost, Anand is back with a second account. So yes, I would definitely like to hear what from other people's perspective. Please feel free to put your hand up or just chime in if you would like to say something. One thing that I wanted to ask people's perspective on is how to respond to this question of hesitancy. And Marlies, that has come up over and over in the international press. And I wonder if people think that it would be breaking this kind of sense of African solidarity to point out that South Africa is actually an outlier when it comes to hesitancy as well. There probably is a little bit more hesitancy in South Africa than there is in other countries. That is also kind of a backup message that I have been hearing, but I worry because now South Africa is being seen as the reference for the entire continent. You know, I heard the head of the National Institutes of Health in the US say on some radio show today, but you know, South Africa has the same exact issues that we do. They don't want to roll up their sleeves and take vaccinations, and they have one of the higher rates of vaccines on the continent. And so I see Marlies nodding. I don't know if you have any thoughts about that. I mean, my first reaction was to say that obviously the People's Vaccine Alliance and the African Alliance and Marlies with Fatima Tian had written that op-ed, about this not being a hesitancy issue, and that came out a month ago. But now, would you agree, or Anand, I see you put your camera on, that South Africa is probably a little bit of an outlier when it comes to hesitancy, and that we should try and find some finessed messaging for that? So Anand, maybe we'll go with you and then back to Marlies.
Yeah, I'm really concerned about that. And I'm monitoring some of the discussions in South Africa. Obviously, they've gone mad with conspiracy theories, and they already were a bit of a hotbed of that. We've just had mandatory vaccine mandates put in Kenya, where we're going to see more of this misinformation, more of this conspiracy theory stuff. We also have very low trust in the state. And I'm really quite worried. I get and I understand some of the pushback against the narratives around Omicron, but I also see that we can be very counterproductive if we're uncareful, because the anger and the racism and the inequality is causing a lot of people here to say, well, sorry, I'm not going to take it then. Obviously this is a conspiracy, and that it's damaging trust here. So I am puzzled how to handle this when I'm doing messaging right now. I think it is a tricky issue.
And I think, Anand, when I saw that the vaccine mandate was being put in Kenya, I was actually very surprised, the fact that the government is now requiring vaccines to enter a lot of public spaces when the vaccination rate is so low. So, maybe we can, it seems like it's not going to work, and maybe just giving an excuse for the government to kind of, crash down on people again, with police presence, et cetera. Would you agree?
The government has done a terrible job here. So we've had stop-start vaccines available, which has been the initial problem. And obviously we had India as well, sucking in all the SSI vaccines, which has kind of fallen out of the debate. So there was a long period of time where we didn't have enough vaccines. Now we've got a surplus. We've got as many vaccines almost as have been given to people. And the government is rushing to try and meet its deadlines, but it's doing some basic things like not telling people where to get vaccinated. It's doing that stuff badly. And I think, like, what I'd love to see is as much energy now going into the local supply challenges and the logistical challenges as these international ones. My feeling, honestly, Maaza, is that the supply constraints globally will start to change quite quickly, but they're going to hit the bottleneck that's within countries. And obviously, Americans only think there are 4 or 5 countries in Africa. We've got a hell of a lot of work to do. So I think we need to do both. And Kenya, although it's relatively advanced in the region, is making a pig's ear of this at the moment internally.
Okay, and just one last question, Anand, before we go to Marlies. You had said that this furor over Omicron was upsetting people and making them less likely to get vaccinated. Can you tell me what you mean by that?
So in South Africa, the conversations I've been seeing is, well, this just verifies that it's a conspiracy. They've got other agendas. We're going to see more variants. All of the right-wing American stuff and Australian stuff is coming into South Africa, and then it's leaking across to Kenya and into other countries as well. So that's where I feel like we have to be very careful the messaging we put out. I think there is also some positive messaging we can put out. And I feel like, obviously there's been anger and real frustration from a lot of people, but we've got to keep a bit more balanced in what we do, not just for the sake of balance, but because otherwise we will put people off, make people feel hopeless. And there's so much complacency anyway, because people aren't seeing the cases here, so yeah, but I'm really happy to hear and listen and learn what else is happening.
Yes, thank you, Anand. And I see, Vasi, you've put a note here. Unfortunately, misinformation, social media have not done good for vaccine hesitancy. Some religious leaders have also contributed to this hesitancy in South Africa, for sure. Marlies, just back to you. It looked like you wanted to say something.
Maaza, I think it was just a support of your point about more nuanced discussion or nuanced messaging around South Africa and the rest of the continent. And I think South Africa has a number of unique issues, having had the first vaccination or the vaccination supplies, our history of AIDS denialism. I think the big vaccine hesitancy and the support of that, I think needs to be seen in a more nuanced way in relation to the rest of the continent. So I would like to hear what people's discussions and thinking around those are.
Thanks, Marlies. Vasi, would you like to chime in? It would be great if you could also just introduce yourself briefly, Vasi, for people who didn't get to meet you at the beginning, and anything you'd like to say about this issue.
Hi, Maaza. Thank you so much. Well, I'm Vasi Naidu. I'm an academic and also part of the People's Vaccine campaign in South Africa, which is a subcommittee of the Active Citizens Movement. I want to just actually, I see Kapil's here on as well. So Kapil's also from ACM and PVC. The vaccine hesitancy, it's really, really concerning. And where it becomes so concerning is that it's not just the layman or the people that will say that don't know about vaccine or are not educated or illiterate. We have varsity students. I mean, there's a final year student that actually will not take his vaccine because his religious leader told him that he has prayed for him and that he doesn't need to take the vaccine. And we have great problems because, especially in lab work, and so some of the academics are asking these students to actually do their work at other times because the vaccinated students are concerned about being infected. So, and I think in South Africa as well, a lot of people are playing too much on this constitution, the freedom of rights, the freedom of doing this and doing that, and that nobody can force them to do it. And now you find that in social media, we're getting clips that are talking to, why are they discriminating against us if we don't want to vaccinate? It's our prerogative, and they make us feel like we like now going on a role of being pitied, to sympathize with me because I don't want to do it, but maybe I'm fearing needles, maybe I'm fearing whatever. So there's another line to it now. So when the science is coming through, first it was all this misinformation about the mRNA doing this to your body and converting your DNAs and you become a monster and all of those things. And then it was the number of years that you were going to live. And as that was being disproved, they're now coming up with new things. So the anti-vaxxers and this conspiracy theory is really killing us because, and like I think somebody mentioned, I think it was Marlies, that that this new variant is also a bioweapon. It's also doing that, and yet you can explain to them in the simplest of terms that it's not that. It's just basically that it's not man-made. But people do not want to accept that. You explain to them that the vaccines, we've been taking vaccines for umpteen years. Then they want to know how come suddenly a vaccine was developed within 10 months when we're still struggling with the HIV vaccine. And then you try to explain to people, but the technology was done a long time ago. It's now just the new organism that we are confronting. So Maaza, so in South Africa, it's multifaceted. It's not just, we cannot just say it's just this, and if the government does this, we're going to correct it. There's a whole lot of things in South Africa. Thanks.
Thank you, Vasi. Joab, I'm sorry you can't unmute yourself. I've just seen a note from Joab. So if you need to log off and log back in, please go ahead and do that. Kapil, welcome. It would be great if you could introduce yourself and give us your thoughts. Just to give you a sense, we started with Marlies giving us an overview of the last few days since the new variant emerged from the perspective of Health Justice Initiative. And we were just talking about how to do the messaging around hesitancy, because there's a lot of that that's coming out now from the global north that, this variant having come out of South Africa, people think, or at least being identified in South Africa, is not evidence of a lack of vaccines, but more of a lack of willingness to vaccinate. And my concern is, and Vasi, I completely agree with you, and Anand, you've mentioned this as well, that South Africa does seem to have quite a bit of that kind of right-wing messaging that is very popular in the US with Fox News, et cetera. The internet penetration in South Africa is also higher than it is in many other African countries. And I wonder if you'd say the same for Kenya. I'm actually very curious about Nigeria. So hopefully Joab will let us know if he's had any interesting discussions there, because I know their internet penetration is also quite high. Joab is back. You know, my concern is really, and Vasi, I completely agree with you. And I think there's been a lot of interesting work done around vaccine hesitancy and how to counter it. My concern is that, you know, South Africa and maybe Kenya, and I don't know, you know, South Africa is such an outlier. You know, when I speak to my family in Ethiopia, one, internet access in Ethiopia is very expensive, as Joab will know, as he spent a lot of time there. I mean, people will spend their entire, you know, monthly salary if they were to get the kind of internet connection that's available in other places. So maybe that lack of access to social media provides less of the disinformation. But my family members are literally desperate to get vaccinated. Like they, you know, they cannot access vaccines easily. So I wonder, my concern is how to nuance that messaging, you know, by saying that, yes, there is hesitancy, but that is not the whole story. And as you say, Anand, you know, the fact that, you know, people are even talking about South Africa in the US press is a big deal. You know, this hasn't happened since HIV or since Nelson Mandela. Like they cannot, you know, differentiate. If you ask them like, where is Gambia? They would have no idea, right? So it's sort of, you know, they will pick one country and stick with that narrative. So I do worry about that and how to do the messaging without making it seem that we are giving up, you know, saying that South Africa is different from the rest of the continent. So that's part of my concern. Kapil, would you like to intro yourself briefly? This is your first time, and if you have any thoughts about this.
Hi, Maaza. Hi, colleagues. Fortunate to be here. Apologies for being late. So I'm Kapil Narayan. I'm a junior doctor working at King Edward Hospital, tertiary hospital in Durban, and currently in internal medicine. So I just want to share a little bit to the conversation regarding, you know, vaccine hesitancy and the current situation that we find ourselves in. I really do agree with what Vasi has said, you know, the previous speaker. I think when it comes to vaccine hesitancy, it's really a kind of multifaceted issue. And whilst it does vary from country to country, there's certain elements like Vasi has mentioned, you know, that come to mind where it's not just individuals who are, you know, as, how can I say, uneducated, but there's many highly educated individuals. There's a religious aspect to it as well. In some cases, I think there's this element where people are really afraid of side effects. So I know, chatting to other doctors, even some senior doctors in Durban as well, they haven't taken the boosters yet. Some of them have taken the vaccine, but they worried about the, you know, booster hesitancy, which is something else that is on the rise because they're afraid of side effects, hearing about colleagues who have taken it and have booked off 3-4 days sick leave. So that's something also, you know, another nuance in which we have to consider is some people who are taking vaccines, but are others who are hearing about the side effects that are happening and are afraid. I think when it comes to kind of messaging, it's kind of instilling, I think we need to instill trust and confidence into the system, because vaccines have been around, you know, for over a century. And part of our, if you look at our EPI, you know, the expanded program of immunization that's done in many countries internationally, there's a full regimen of vaccines that we take for our children, that we ensure that they, you know, get their you know, polio vaccine, their BCG vaccine, and the whole list. So why is it different now? And part of that is that there's a lot of, I think there's a massive misinformation and disinformation, this infodemic that we see. In fact, in the infodemic and this misinformation has been really listed by WHO as one of the greatest global health threats after, I think, 2019 or 2020, prompting the WHO to have a infodemiology conference, the first of its kind. So these are just some of the challenges. So we need to ensure that we instill confidence, instill trust in individuals, but in a culturally sensitive way, noting the many religious challenges as well. And in some cases, like I've mentioned, like has been mentioned by many colleagues, it's not this issue of necessarily this whole anti-vaxxer movement where there's a massive theology behind it in South Africa, but rather some people who are just have some genuine concerns. And then there's the other group who are just against it for whatever it may be, religious reasons as well. So that's just a little bit from my side. I think I've overlapped with what many people have been saying, but just to share a bit of points on my side. Thanks.
Thank you, Kapil. Does anybody have any thoughts about this? Joab, I had posed a question just to, oh, I see Kavengo has raised his hand. Kavengo, why don't you go ahead, and then Joab, I'll come back to you.
Okay, thank you very much, Maaza. I just want to add my voice to what colleagues are saying about this issue of hesitancy. It's actually true. Here in Kenya, and what Anand has pointed to, and I think Korao is correct, there is rising hesitancy on the drug. And recently, the government, I think last week or so, announced that it was going to deny people services if they are not going to be vaccinated by this date or that. I think that is quite unfortunate. The government should instead find out why there is this hesitancy on the part of the people. Nobody wants to die. So when they pick this very quick and authoritarian kind of strategy of forcing people, in fact, they are looking for ways to beat people like they did when COVID first arrived here, as if, it was just residing in the night, and they beat up people, people slept in the streets and things like that. They want to do exactly that again, instead of, finding out why the messengers of disinformation are outsmarting them with the misinformation they are peddling. They have all the machinery to convey messages across and in a better way than the guys who are holding or hiding behind their keyboards and typing messages which people appreciate. Why are they being outsmarted by few individuals who are not having the correct information? That's a question they should deal with. And if true, they are going to force people into, to deny people services on the strength of not being vaccinated, I'll tell you this. There are so many people in this country, and I believe in many parts of Africa, who get no services from any government. So those people don't even know that they are denied the services. They'll continue peddling their COVID out there, and the few who have been vaccinated will be, met with the new Omicron or any other variant that will, by the way, we've not seen the last of it. So the governments need to do better in Africa to counter the misinformation, disinformation, and this kind of narrative, instead of picking these authoritarian kind of strategies of beating people, denying people services. They have all the machinery they need to do a better job to convince the people. First of all, why are they being not trusted by the people? I think these are issues they need to deal with first. Thank you.
Thank you, Kavengo. Anand, I see your hand is up, but I will come back to you. I'm just curious about, the rest of the continent, wondering, Joab, I know you said you were doing some media work in Nigeria, and Charles, I know you're in the UK at the moment, but have links to Nigeria. Is it, in terms of nuancing the messaging, are you seeing the same or hearing about the same rise in hesitancy? Or the other question would be, has anyone seen a good study recently, Africa-wide, that is really measuring hesitancy around the continent? I don't believe that there has been one. There was one in December that Africa CDC had done, looking forward to when a vaccine would be available. And at that point, the acceptance was quite high. So Joab and Charles, I want to put you on the spot, but Samson, I see your hand is up. So I'll come to you. And then if Joab and Charles don't have anything to add, Anand will come back to you. And Samson, please intro yourself briefly.
Okay. Thank you very much, Maaza. Good afternoon, everyone. Sorry I joined the meeting late. I had a previous meeting that ran over into this, but I've just caught up with the discussions by the last presenter. And I want to agree with what's going on. I think that was Kavengo. I want to agree with what we are discussing here today around vaccine hesitancy. We are seeing that as well in Kenya. We are seeing a trend of people who call themselves woke, quote unquote, and who are saying that they are proud to be unvaccinated, because there's this concept that the vaccine keeps on mutating the elements within the faith groups that also still believe that issue around inoculation, that issue around, I don't want to call it propaganda, but that issue around, its own challenges and so on and so forth. So the fact that we had lockdowns and then we had politicians here in Kenya doing their normal campaigns as normal. We're doing elections next year, and yet people are saying you are on lockdown, wear your masks, social distance, but we will see the president, we see his deputy, we see all these other people moving around. And the fact that, people don't necessarily see those scary messages around people wearing gowns and so on, ambulances, all that has died down right now. So there's a lot of normalization of this, that this thing probably does not even exist. And yet there's also the concept of which vaccines are these, where are they coming from, and the elements in the church that are opposed to this. So it's a bit of a worry here within the country, especially for those of us who work within civil society, knowing that we would be having a lot of, challenges with the increasing numbers and the increasing points for infection masses. So it's something which we are dealing with, and then coupled with, the news that came out of South Africa, but we also now see increasingly other countries as well, including the West, including countries like Australia, where we are seeing the Omicron virus now coming in. So it's a delicate balancing situation, and our bureaucrats don't help the matters either by some of the not properly thought out public policies that are imposed on the public, and then now there's no enforcement, there's no compliance. And people begin seeing vaccination. The government came in the other day and said, if you're not vaccinated, you don't receive government services. So you can't get an ID, you can't go trade in the bank, you can't do anything without a vaccination certificate. Now there are two things here, Maaza. One, Kenyans being Kenyans, there are elements within the Ministry of Health that are selling vaccination certificates. So you pay them about $10 and you're able to get a certificate without being vaccinated. The second bit is that people are then saying that if the government is saying you don't get this service if you are not vaccinated, does it mean that the taxman also does not get his tax when you're not vaccinated? So again, those kinds of, it's a delicate situation, it's politics out there, and this is the point when even some politicians, depending on who they are addressing, choose to be vaccinated or choose not to be vaccinated, and people listen to politicians so much here within the country. So I think we still have a long way to go, coupled with the fact that the discussions around vaccine equity between the global north and the global south is still there. So we still have a long way to go as a country and even just as a continent, Maaza. Thank you.
Thank you so much, Samson. And that's actually such a good point about this demand for people to be vaccinated fueling corruption. That's a whole other layer, even to enter services or to get cards, etc. So Joab, let's go to you, and then Charles, and then Anand will come to you.
Thanks a lot, Maaza. It's clear that once we started receiving vaccines, our governments did not invest as much as they invested in creating awareness when we first started witnessing the COVID cases. So I see that's where the rain started beating us. The WTO, recommended budgetary allocation towards creating that awareness. No one is following up on that. So for me, it will be useful to, on this call, to discuss a bit on how we as civil society can actually start addressing some of these problems. We know it's not our responsibility, but we have a role to play. How do we connect with each other? For example, I know that my Kenya colleagues are planning to do some work around vaccine hesitancy, colleagues in Sierra Leone, the same in Burundi, Zimbabwe. So how do we also on this call just connect and share with each other what we're planning to do so that we do not duplicate efforts? And I'm happy to have calls separately with those who are working in these countries and connect you with our teams in these countries. I know that our team in Sierra Leone is planning to do a quick study on the I'm just trying to open the document they just shared this afternoon, on the hesitance itself. You know, what are some of the things that are driving this hesitancy? So happy to connect with colleagues on this call who are interested in these specific countries. Yeah, and we're also looking to do, for example, in Kenya, I know that the team is having a meeting tomorrow with one of the leading media stations, that's the Royal Media, to see if we can start using the media to deal with this information around vaccines. So Anand, Samson, happy to connect.
Mm-hmm. Thank you so much, Joab. And Marlies, thank you for putting that quote in. I mean, I think this is really what we're trying to get to today is, yes, you know, there is hesitancy, but it is now being used as a response to the demands for the TRIPS waiver and for increased equity. So I'm hearing that over and over, that, you know, the reason why Omicron appeared is not because of a lack of vaccines, but because South Africans in particular, and then they're using that to say Africans generally are actually more hesitant than we know. So it's really about how to respond to that messaging. And Joab, yes, for people who are working on hesitancy issues, it would be great for people to connect. And I see Tian has joined us, and I know that Abda also does work on hesitancy issues. Welcome, Tian. Charles, let's go to you, and then Anand.
Thanks. This is a great discussion. I mean, vaccine hesitancy is such a fluid term. I mean, some countries in Europe had higher hesitancy rates than Africa, until some of the governments really pushed and made it almost impossible for them not to get vaccinated. So I'm actually doing some work as well, looking to access to vaccines in Nigeria at the moment. And what we're seeing, talking to people there, is that there hasn't been this demand creation. And I think Joab mentioned it, that they sort of dropped the ball on really trying to create the demand for having the vaccines being uptaked. And this goes back to, I think something someone else said, Kapil said, about what sort of communication is really necessary. We're still sort of trying to, in the wave of this infodemic and all this misinformation, disinformation, we're still pushing out messages through the sort of traditional platforms, and not really focusing on where that disinformation and misinformation is. So I think a lot needs to be stepped up in that regard. Thank you.
Great. Thank you, Charles. Anand? Oh, you're still on mute, Anand.
I haven't done that in a while. Coming back to what Kapil was saying about religious communities and hesitancy. So we're going to be launching a big public campaign in Kenya. Joe, I'd love to talk to you about that. We're going to be working a lot with AMREF and the UN offices to push that. But one of the key networks will be religious leaders, and then also influencers and kind of sports celebrities. You know, we have the best marathon runners in the world. So we're going to get Eliud Kipchoge and others and people like that. But if we can get mosques and churches to repeat the message, and we're seeing more of them doing that, but make it easier for them, that will be important. Maaza, you asked about vaccine hesitancy. I'm still reluctant that we talk too much about it. Like in Kenya, I said that I'm worried that it would start spreading here from South Africa, and it's spreading online, but it honestly is not that much yet, although there is definitely the worry about side effects. So there is the UN ERA, I don't know if you're aware of it, the Africa Infodemic Response Alliance. So they actually do a very comprehensive report every week, and they're monitoring all of the different misinformation and disinformation. They do a report every week and then they swallow it. They don't share it with anybody. It's so absolutely stupidly frustrating. I get it leaked to me, but that might be good to look at in the next couple of weeks, because there is a UN effort that has people in different countries doing this great work, and then not knowing what to do with it. I think one of the problems here is that we have people thinking still in boxes. So we've got a lot of medics suddenly going, I've never really dealt with misinformation at this industrial scale before. We've got people who are fact checkers not knowing how to put things then into practice. So we've got to somehow move across those barriers with the limited capacity we have. And going back to your earlier point, I think it would be really important to split off, like, what is the messaging we need for the outside world? And then what is the messaging we need for Africa? Because we're getting these vaccines piling up. We're getting them piling up in South Africa and in Kenya. That's a real problem, but it's almost like it's going to be used against us. Zeynep Tufekci did a very good article in the Washington Post about what you were saying, Charles. Like, we haven't really created the demand, but I know even our incompetent Ministry of Health in Kenya were struggling because they didn't know that they could meet the demand if they told people, because they didn't know if the supplies were coming. So it's been chicken and egg. But yeah, I think it might be good to kind of separate those two things and make sure we do cover them both, the external and the internal.
Mm-hmm. Excellent. Thank you, Anand. And I wonder if part of the reason, that ERA push out is not good is because they worry that it counters the message that, the DG has been so good about pushing about, we need more vaccines. We are in the middle of a vaccine desert. And I wonder if there's a sense of conflict about how to do the messaging carefully. No, you're shaking your head.
I think it's more incompetent than any decision. I think it's just the UN in its different silos, honestly. Okay. And then I wonder if we also, and I'm just going back to that great quote that you shared, Marlies, like, nobody says, that because the US has serious vaccine hesitancy that they do not deserve vaccines, right? So kind of insisting on that message. And then Anand, the point that you bring up, which Tian, maybe you can add a little bit onto, is this thing about the way the vaccines are coming. What I'm told is that it's in a very haphazard way. Sometimes vaccines come without syringes. We're now seeing a shortage of syringes, and it's a stop and start that leads people to be even less likely to get vaccines if they come in a way that's really disorganized and the system can't be ramped up in time. So I wonder if that's part of it as well. Tian, I know that with ABDA, you've done quite a bit on this. So if you have anything to add, and please intro yourself just in case anybody here does not know you. And then Anand, it sounded like you looked like you were gonna say something as well. So please feel free to raise your hand if you have anything to add. Tian?
Hi all, thanks Maaza. My name is Tian Johnson. I'm with the African Alliance and have the spectacular privilege of working with Maaza Seyoum, who obviously with our PVA Africa work. I think from the outset, we're going 18, 20 months now, we've been saying this, that you have to look at vaccine hesitancy in a historical context. But I think especially in the current moment, how are we creating demand in the absence of secured supply? How do we get communities interested, excited, mobilized when they don't know? As Fatima keeps on saying, for those of you who follow on Twitter, it's drip, 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 it's never ending drip, And so how do we get communities ready for these vaccines that are coming in? How do we know in advance? We're back to these old discussions, and I'm saying old, it's only been 12 months, but these old discussions around begging for delivery schedules. Why are we here? Why are delivery schedules still shrouded in spectacular secrecy? And we occupy spaces at ABDA level, at the CDC, and this is something we raise every 2 weeks. We need the secrecy around delivery schedules to be lifted, and that's just not happening. So I think we're going to continue seeing this play out over the next few months, but I also think that we as African activists perhaps have not spent enough time, and maybe it's just a coordination function, really thinking about responses to what the world is now presenting to us. We've gotten a range of media requests this week, at least 12 and counting, and we're kind of getting the side eye. Oh yeah, you guys were going on and on, you want vaccines, you've got millions sitting in your country. So what is that about? And so I think we do need to unpack sporadic deliveries. We do need to continue pushing the need for accountability and transparency and holding our local governments accountable. We have to hold our own governments to the same standards, if not a higher standard, than we hold both pharma and the global north to. Thanks, Maaza.
Thanks, Tian. Anand, did you want to add any final points to this part of the discussion?
No, I think I'm okay.
Okay. Does anybody have anything they want to say about this? I just want to thank Marlies for starting us off, kind of giving the overview from HJI's perspective of what's happened in the last few days. And then we kind of shifted into this discussion of how to address the comments that are coming about African hesitancy. I'm happy that people who are working on hesitancy are going to be linking up with each other. I see people sharing notes within the chat. And I will share the links, Marlies, that you have shared here in the notes as well from the meeting. Any final points about this before we move on to the next item? No? Okay.
Sorry, Maaza, if
yes.
I can just come in.
Yeah.
Sorry, Maaza, if I can just come in. Some point that I forgot to mention as well, and I've been seeing with some clips that came through my chat, is this thing about the big pharma, So you have people that are very, against the big pharma and feel that this was actually being done by big pharma. So it's the same with the HIV and AIDS story, and that now they created this so that we can start buying their vaccines. And it is basically that they would not make big pharma any richer than what they are by taking the vaccine. So it's like a cutting the nose to spite the face kind of a thing. But it's something that's coming through also from very so-called highly educated professional people. So this is something that I thought that we haven't actually touched on, but it's also this thing against big pharma and what they have done. And as much as you try to explain to them that in South Africa, our pricing is regulated, when you talk about the drugs and things. So, and that was due to our previous Health Minister, Nkosazana Zuma, that we've added this, and we have parallel importation. So all of those things are there to actually protect us from this type of pricing abuse, but people will still not listen, So yeah, so it's really, really a major concern for South Africans that we have so many, almost 60% or 60+% that have not been vaccinated, and due to all of these things. Thanks.
Mm-hmm. Thank you, Vasi. And I think it doesn't help that, yes, indeed, 5 pharma CEOs have become billionaires in the last year, right? So it's sort of about that messaging as well. Yes, they are making money. Yes, as Tian says, we need to be more insistent about the contracts and how they are signed, et cetera. But yes, it's many layers of messaging for sure. So thank you, everybody. That was a great discussion. I wanted to now move us into what we are calling the Africa Week of Action. I don't know if any of you have seen the emails that I have sent about that, and I will share the screen and show the current plan. I'm sad that Suhail Omar from People's Vaccine Kenya is not here today, because the idea initially came from him at one of our PVA meetings, I think 2 months ago. Suhail was saying there's been a day of action, from the People's Vaccine Alliance, I think targeted at pharma. There's been a week of action targeted elsewhere. Joab, I know you have to jump off. Before you jump off, Joab, I wanted to talk about the Kusi Ideas Festival. So maybe so that's part of the Africa Week of Action. Joab, before you jump off, why don't you go ahead and tell people about the Kusi Ideas Festival, and then I will kind of circle back and talk about where it fits in the Africa Week of Action.
Yes, Maaza. We thought that Kusi Ideas Festival, which is holding in Ghana on the 10th and 11th of December, will also be a good space to talk about vaccine equity, vaccine hesitancy, and how our leaders are actually investing in our public health systems. And so we applied for a panel, which we've been granted on the 10th, and we're putting together a panel around COVID vaccines and how the rollout has been on the continent, and the whole politics around acquisition of these vaccines. So that's still work in progress. I know Maaza knows the details of this, so happy to answer questions if any one of us has them. So it will be holding up in Ghana. It will be opened by the president of Ghana and the president of Uganda. A couple of presidents will be joining virtually. And we just got confirmation that it will be a hybrid event where we'll have people physically in Ghana and others will be able to join in virtually.
Okay, that's great, Joab. That was part of the concern, is that initially I had heard that from your colleague Robert that they wanted people to be there in person, so it kind of frees it up a little bit if it's a combined event. So just as I was saying, the idea came from Suhail to maybe do a week of action focused on Africa, and there was a lot of interest at the People's Vaccine Alliance in supporting this. And a few different people were already planning a variety of activities around this time, it being World AIDS Day tomorrow, ICASA coming up, a lot of sessions linking COVID and HIV. So I know that Suhail does have some activities planned, and we're still waiting to get the full summary of those, but I will at least share what we have in the works. And I think many of these activities are linked to what we've been talking about. Can people see the screen? Yes, okay, great. So I just wanted to run you through the activities that we have planned so far, and please, let me know if there's anything that I've missed, but also we are really looking for people to join in these activities. Next week, December 7th, we have the panel that we have planned with Marlies and her team at Health Justice Initiative and the People's Health Movement. This is the third in a series of webinars that we referred to back then as the 5% continent. Now maybe it's the 7% continent, Marlies, but this one is actually on African solidarity. So I think the timing is good. Unfortunately, it being the end of year, people are so busy, and I know Joab has experienced the same with Kusi. It's really hard to pin people down for sessions. So I'd be very curious to hear your thoughts about this. We did get Dr. Gitinji from AMREF to say that he will join, but only for the first 20 minutes to kind of set the scene. And then we have Dr. Catherine Kyobutungi from Uganda, who has agreed to stay for the whole session. And then Buba was able to get Mohammed from Africans Rising. They actually don't work specifically only on COVID, but kind of the sense of African solidarity more broadly, and where COVID, vaccine rollout, vaccine apartheid, and kind of COVID recovery fit into the discussion. We had really wanted to get somebody from Morocco to talk about their experience with vaccine rollout, because as you all know, they have done very well compared to the rest of the continent, especially for being a large country, different from Seychelles and Mauritius, who have also done well, but Morocco as a large country has done exceptionally well. Very difficult to get permission from the Ministry of Health for them to release this person who's their Director of Medicines and Pharma to come and join us. So there's still efforts to get somebody from Morocco, but I'd be curious to hear people's thoughts on that. Given Omicron and the kind of change discussion, should we just leave out Morocco, let that go, and just kind of focus on sub-Saharan Africa and the issues that we're facing? Anand, I see you shaking your head.
Yeah, I think we need to remind people that Africa is big.
Yeah, okay. I'll give it one last push today. And then we also had I should remove Lois from here. Lois is at ICASA and will not be joining us, but she has recommended, and Joab, I don't know if you're still with us, I know Christian Aid is quite interested in Zimbabwe and their rollout, which has been quite good. Lois had recommended getting somebody from the Ministry of Health in Zimbabwe, which she has a contact to. I don't know, Joab, if you have any thoughts about that, given Christian Aid's Vaccine Equity Index. I know that you're focused on Zimbabwe, or anybody else have thoughts on this? Joab, I can't hear you. I don't know if you're trying to speak.
Sorry, Maaza. I didn't get that clearly on Zimbabwe.
So Lois had recommended, since she herself can't join, maybe rather inviting somebody from the Ministry of Health in Zimbabwe. She has a contact to somebody there to talk about their vaccine rollout, which has been, and I know I've heard you and Robert talk about the fact that one of the reasons why you were including Zimbabwe in your equity index at Christian Aid is because they have done surprisingly well, but sort of under the radar. So just wanted to know if you had any thoughts. Should we really push to get somebody from Zimbabwe at this panel if we can? What are your thoughts on that?
I think it would be good to get someone from Zimbabwe. I mean, the decision at an early stage to decide to go for the Chinese vaccines and what was driving that, and these numbers are not being counted. So it might be good to hear from someone from the Ministry of Health there.
Oh, okay, great. So any thoughts about this, African solidarity? Is there anyone that we have, obviously it's short notice now, it's a week from today. I hope you will all join, and we'll send you the details for joining. And Marlies, any thoughts from you while you're here? I know, Marlies, that you had thought it would be a good time to also discuss, having some kind of manifesto or charter. So if we have time, I'll also give people a sense of where we are on the Africa Charter that all of us have been feeding into. Any thoughts from you, Marlies, on this session, since you're the co-organizer?
Maaza, I think these are great speakers, and I know you've been working really hard to confirm people now already for months. I think the confirmed speakers are great. I think the pending speakers, if they come, it's amazing. But I think the webinar is going to be very interesting with those speakers. I think the tying of the event somehow to a declaration was one idea. I think the charter, the latest version that you share, is a very strong document, and it would be nice to talk a little bit about timelines. When will we? When is this group thinking of perhaps finalizing it and launching it? Because it's I think it's an inspirational document.
Okay, great. Thank you, Marlies. Any thoughts from anybody else on this webinar? And then I'll quickly go through the other events that are taking place in this week of action. I can't see the hands, so if you have anything, please just chime in. Okay, so then the next one is that this digital memorial wall, I'm sure you've seen the emails about that, will be launched on December 8th. It will continue after December 8th, but it will at least be launched on that day. This is the wall that was brought up actually here in this meeting 2 months ago as a way to kind of memorialize all the people who have been lost to the pandemic. I'm sure you've seen the forms that I've been sending out in English, French, Swahili. We hope to have Arabic soon, and please do share those. We've had about 60 responses so far, but a big influx of responses from the US because of a link that the People's Vaccine Alliance has to a memorial site in the US as well, memorial website. So please, send these out, and I will do one final reminder at the end of this week, but we do have all the languages. We are also hoping, and I don't know if anybody here has capacity for this, but we really wanted for social media to do kind of short videos or short clips that we could post along with the launch. I know it's a big ask at the last minute, but if any of your organizations have capacity to help with that, please let me know. We're still waiting for Open Society to confirm whether they can. Any questions, comments about the digital memorial wall? Okay, if there are none, I'll move on. Tian, maybe I'll let you speak about this panel, which you are on with the head of UNAIDS and with Lois on December 9th, which is at ICASA. Anything you'd like to say about this, Tian? I know that there are also a lot of other, as I said, I put the link in the document that I sent out here. You'll see that there are so many other sessions that are linking COVID and HIV. So I'd be very curious to hear from those of you who are here, especially those of you who are based in South Africa and might be attending. I don't know if there's anything that we can amplify or work on together at this last minute. But Tian, any comments from you about this great session you'll be on?
Thanks, Maaza. No, just to say we'll be sending out social media invites, etc. So stay tuned to our timelines. And yeah, if anyone is planning to attend ICASA, would be great to see you there.
So Tian, you will physically be in Durban then for ICASA?
Unfortunately, that is looking increasingly likely, yes, Maaza.
Okay. Anybody else from South Africa going to ICASA in this group here? Kapil, I know you're in Durban, aren't you, Kapil?
Hi, Maaza. Yes, I am in Durban. Unfortunately, I won't be attending, though I would have loved to, because due to work.
Oh, I've just lost you. Can you hear Kapil? I've lost Kapil.
Hi, I said I would have loved to attend the ICASA. It's just because I am also in Durban and really passionate about HIV, having worked on several movements and campaigns and done a little bit of HIV awareness and research as well whilst I was a medical student. But it's looking increasingly challenging with the ward commitments, especially noticing that there is a slight increase in the number of cases, and that's only going to go up from there. So the wards may be quite busy.
Okay, gosh, all right. Well, we wish you luck. I know I can't imagine being a doctor now in December going into the holiday season, so we'll be sending you strength. Anybody else either attending or have any abstracts that you have submitted as part of this COVID HIV link that you'd like to tell us about? No? Okay, so please keep eyes peeled for the session that Tian will be on, and we will keep you posted. So then here's the Kusi Ideas Festival. I put the link in the chat. Unfortunately, Joab had to sign off, but apparently this is a quite high level festival, which I must admit I had never heard of. The first one was organized by Kagame in Rwanda 2 years ago. The second one was in Kisumu last year, and it's really kind of combining business and health. And, you know, there's a sense that they want speakers that can speak to really distribution and manufacturing issues. So Joab is trying really hard to find people. Initially was trying to find people who are already going or were in Ghana, because they had insisted that they wanted people physically there, but it seems that they have changed their tune in the last couple of days. So if you have any thoughts about this, please email Joab. If anybody has a direct line to Strive Masiwa, who will apparently be there. I know Joab had hoped that maybe Strive Masiwa could be on the panel. Also, the Ghanaian Minister of Health is an option. Yeah, if you have anybody, unfortunately, we don't have anybody from Uganda on the call here today, but with the president of Uganda going, there might be some additional interest. Any thoughts, questions about the Kusi Ideas Festival? No? Okay. And then finally, there is this first international conference on public health in Africa, which is taking place in Kigali. But Tian, my understanding is that it's fully virtual, though, that it's being organized out of Kigali, but is virtual. We have managed to secure a side session, which we hope to get the regional partners that African Alliance has been working with for ages all around the continent, talking about how COVID the pandemic has affected the other work that they've been doing and their plans for the next year. Tian, I know that this is out of Africa CDC, the African Union. Do you have any additional information about this conference, Tian?
No, Maaza, but just to share your excitement that we really, we're really excited. It's now an official side event. And we think it'll be really a key moment to profile not only the work we've done in the last year as African civil society as a collective, but also take that time to strategically think about the opportunities and the threats that 2022 will likely present us with. And there's certainly no shortage of either.
Okay, so please.
But Maaza, I just wanted to touch on the issue of Strive Masiwa at Kusi. I do think there's a strategic opportunity there to really perhaps increase the volume of our voices around holding African leaders to account. Mr. Masiwa is exceedingly powerful in the African health landscape, as I'm sure we all know. And I'm just putting that out there. As a member of the Vaccine Delivery Alliance, I am just putting out there that I think activists would be quite spot on to begin to think how we can hold Mr. Masiwa, who's really the driving force behind that, to account for his actions and his leadership in terms of how we've responded to the pandemic.
Thanks, Tian. And I think that was the idea, you know, when Joab had wanted to have him on here, was really to be able to ask him some tough questions. I know that within this group, there was a little bit of concern about Strive Masiwa and his closeness to some pharma, et cetera, in the last few weeks. Anand, I see your hand is up.
Yeah, just slightly more generalizing that point. Like we have elections in Kenya, and one of the things we're probably going to be pushing is like which counties have very poor vaccination rates, and can we actually create some political pressure around that? It's going to be a big ask because people get very distracted during elections, but we could actually use that as leverage. So it's something we're definitely thinking about here.
Okay, thank you. And that's something that's really good, you know, Anand, I feel like we don't talk about that enough. And Tian, I know that you have started doing quite a bit of work with, you know, where are vaccines going in the continent, in the various countries. But yeah, as we kind of build access, that's a great point, Anand, thank you. So people, if you have any thoughts about Kusi, please email Joab. If you have any thoughts about the first international conference on public health in Africa. Tian, do you know if this is, I think I saw on their website that it's completely virtual. Is that what you've heard as well?
Yes, Maaza, it will be virtual.
Okay, excellent.
The Kigali, Rwanda one is the manufacturing partnership meeting.
And when is that?
Hold on. So it was supposed to be the 1st to the 2nd, and if I don't have my dates wrong, it was moved to the 6th and the 7th of December. Yes, it was moved to the 6th and the 7th of December.
Do you think that should...
The Partnership for African Vaccine, let me just copy and paste this into the chat. So yeah, I'm just copying the registration and the blurb into the chat. So that's the 6th to the 7th, and that will, in a very small way, be held in Kigali, but the bulk of it will be virtual and online. I've put that in the chat.
Thank you. And do you think, Tian, that should be added onto this Africa Week of Action events?
I think we should. I think every single opportunity, especially now with the African Union and Africa CDC, I think that civil society needs to make its presence felt. And certainly beyond those of us who are on the structures internally. So I do think those spaces need to be broadened and opened up.
Okay, so I will add it onto the list. So really here, and as you can see at the end here, sorry, the People's Vaccine Kenya does have some activities planned. Suhail had said at the meeting that we have a small planning group that we've created around this that meets every Monday at 3 p.m. Nairobi time. Actually, sorry, 4 p.m. Nairobi time. And what Suhail had said to us is that PV Kenya, and Anand, I know that you work with PV Kenya, so if you have any information about this, please let us know. But Suhail had said that he was hoping to have a series of events that were really different from the regular kind of formal Zoom chats, having some Twitter Space, Instagram Live, other, in-person stuff as much as COVID allowed. Do you know how those are kind of shaping up?
I don't, although knowing Suhail, strap yourselves in, it's going to be strange. It's going to be good, but I haven't heard for a while.
Okay, all right. Well, I will follow up with him and see if we can get more info on that. And then there is hope to have an op-ed with a scientist in South Africa soon within the next week. So for those of you who saw about 8 months ago in March, there was a survey that the People's Vaccine Alliance had done with infectious disease specialists around the world, kind of saying, if we don't roll out vaccines, we will soon see some worrying variants. And the People's Vaccine Alliance thought this would be a good time now with Omicron to say, we told you so, and get one of those scientists who had a quote included in March to join up with the People's Vaccine Alliance to write an op-ed. And then apparently Winnie Byanyima has an op-ed that she is co-writing with Oxfam International and the People's Vaccine Alliance soon, kind of, I think, linking HIV and COVID coming out in the next week or so. So please keep an eye on the People's Vaccine Twitter handle. Obviously, Marlies, the Health Justice Initiative Twitter handle is very busy. People's Vaccine Kenya, African Alliance, and please register for as many of these events as you can. If you think you have capacity to help, please send me an email, let me know, and I'll happily add you to our weekly meeting. This is a lot of work to get all of these activities out. So it would be great to have additional support if possible. Any questions, comments, thoughts, concerns about the week of action? Marlies gives me a thumbs up. Anybody else? No? Okay, great, thumbs up, thank you. So then the last thing that I wanted to talk about, and I should share my screen again. Yes, Marlies, fully agree with you that we need to set, I don't have it open now, but this is the Africa Charter, which all of you have been filling in information on for the last few months, and we really do want to get that out. Thank you to all of you who have provided inputs into the African Charter on COVID-19. Marlies, Charles, Joab has already signed off. A few of you have really spent quite a bit of time putting comments in. We are just waiting for final comments from our Global South colleagues at the People's Vaccine Alliance. We wanted this to have an input from both Latin America and the Caribbean and Asia, and also just kind of a policy check from Dr. Moga at the People's Vaccine Alliance for that section of it. And with things being so busy at the end of the year, we are still just waiting to get those final pieces of feedback. Tian, is there anything that you would like to add about the African Charter on COVID-19?
Nothing from my side, except just to reiterate, thank you so much to everyone who made inputs. I think we're at the finishing line, and certainly before we close at the African Alliance on the 13th of December. So certainly before we close, we hope to wrap that up, get it out. It'll be on the website, and then, yeah, spend the better part of January pushing for sign-ons. Thanks, Maaza.
Okay, thank you. Any other comments, questions about the Africa Charter on COVID-19? No? Okay. And then the final thing that I had on my agenda was I just wanted to remind everyone, I see a hand, Kapil.
Sorry, Maaza, I've come a bit late to the party. Is it possible to still provide comments on the charter, or has it already been finalized?
I will send it to you as a special case, Kapil, and send it to you just as a Word document so you can do have a look and track changes. I've already removed the editing capabilities on Google Doc just to stop things there, but I will send it to you today, Kapil.
No problem. Thanks, Maaza.
Sure. And then the final thing that I wanted to just get on everyone's radar is that the People's Vaccine Alliance has recently received a promise of funds. So this is the first time that the People's Vaccine Alliance has received money in the last year and a half of doing this work. Everyone has been doing it just in addition to their regular tasks, kind of pro bono. There was one full-time staff member at the People's Vaccine Alliance, and that's Valentina, who many of you may know, who's the coordinator. So now there are some funds coming in. They hope that that will be dispersed early next year. The African platform, the Latin American platform, and the Asian platform will have the opportunity to have members submit applications for funding for small grants. So I just wanted to get that on your radar. That will hopefully be starting early next year. The funds have come from the Ford Foundation and the Rockefeller Brothers Trust. We, for a while, have been talking about setting up an official steering group at People's Vaccine Alliance Africa. And we think that with these funds coming in, it would be wise to have the steering group in place. So any small grants that are dispersed will be decided on by that steering group. Tian, anything you would like to say about that? I know we've sent out the first communication. Any points you would like to raise about that now, Tian?
I think just to say, the aim here is to make it as a minimally traumatic on everyone as possible in terms of putting together proposals. So, we're not going to be asking you for a 52-sheet log frame and detailed indicators. But I do think that putting together the way we've attempted to structure the steering group that we hope will be the body that will review calls for proposals. Of course, conflict of interest as it arises will be dealt with. We're finalizing a pretty comprehensive conflict of interest policy, but the intention is we've approached regional civil society leadership. So one leader per region of regional civil society networks to serve on this group, and we hope that it will be their happy job to review and make recommendations on funding for those potentially quite small grants. But we do hope that they might have some impact when they do land. Thanks, Maaza.
Thanks, Tian. And, I think that the People's Vaccine Alliance Global Steering Group needs to make a formal decision on whether anybody who receives these grants needs to be an official member of the alliance. That decision has not been made yet, but I think that will likely be the case. So I just want to remind everybody, obviously, that this informal People's Vaccine Alliance Africa meeting is open to anyone, but some of you have made requests to join the People's Vaccine Alliance formally. And what that means is really that you have to say that you agree with the People's Vaccine Alliance mission. They might ask going forward for any kind of conflicts of interest. If your biggest donor is Pfizer, you might want to declare that, that sort of thing. And then once you join, you would get all the regular emails, and you would also have the possibility to participate in the various working groups. So the People's Vaccine Alliance has a policy and advocacy group, campaigns and media, stories group, which are all a really great way to get African priorities and strategies included. So please feel free to send me an email if you have any questions about that. I know many of you are members. Action AID is a very active member of the People's Vaccine Alliance, Samson. Charles is on a couple of groups, I think sits on the policy and advocacy group and the campaigns and media group. Anand, Suhail and People's Vaccine Kenya are both active members of the People's Vaccine Alliance, but I just want to get that on your radar. If you are not a member and you are interested, Marlies, everybody thought Health Justice Initiative was an official member until last week, when it ended up that Health Justice Initiative had not signed on. So finally, Health Justice Initiative is an official member of the People's Vaccine Alliance. So please send me an email if you have any questions about that. Okay, any questions about funding, the steering group, anything else going forward? Anand, it looks like you're about to unmute yourself. Yeah.
That's the problem of being on video. You can see what I'm thinking. Just more generally, coming back to this thing about, we're going to get pushback that South Africa has extra vaccines, Kenya has. And I'm just thinking, does the focus then become saying, it's not enough to get the vaccines to Africa, we have to go that last mile. And how do we get the infrastructure in place, the support in place, because these countries just don't have it. And that also gives the opportunity to talk about the logistical challenges, just the sheer geographical challenges and the cold chain and all of that. So I'm just thinking maybe that might be a way to swing the discussion to say, it's not enough just to have them land at the airport. And I'm wondering, you talked about opinion pieces. I'm wondering, it might be worth putting something in the continent. I've been thinking about pitching something and they've been publishing some good stuff, including from the Ugandan doctor you mentioned. But is that one of the avenues you were thinking of using? Yeah.
That's great. I mean, that would be amazing, Anand, if you'd like to write a piece. And I know that, one of the hopes, the People's Vaccine Alliance, something that they want to use their money for at central level is a writer that can help people in, our team or others, Latin America, Asia, to kind of get op-eds finalized and placed. But if you are inspired to start one, that would be, and I love the continent. I mean, they have really good stuff, easy to read, very well designed. So yeah, that would be fantastic. And I wonder, Tian, if you have any, I know that African Vaccine Delivery Alliance is also trying to pivot a little bit from the discussions of just global access to now roll out at country level. Any thoughts, comments about that, responding to Anand?
Yeah, I mean, just when Anand spoke about cold chain, it made me think that is perhaps one of the areas we need to really pay specific attention to in terms of how we characterize it. Because of course, the current moment, we have everyone just waiting on edge for the slightest crack in any kind of African country response to say, aha, we told you so. They don't have fridges. A year ago, I remember I was on an ABDA call and we spent a ridiculous amount of time discussing, are the Africans going to steal the fridges? What is the security plan for the fridges? And so I'm imagining now if we almost introduce or further spotlight cold storage issues, it could be another, you see, they don't have cold storage, where the advocacy could be placed on vaccine options that don't require such stringent cold storage. So I think as we do move ahead, we could also consider how we preempt the vultures that are certainly circling. We saw it with Bola, around, Africans are vaccine hesitant. What's the fuss? I'm sure he's having an ecstatic week this week, saying, see, told you so, with what's happening in South Africa. So I think, yeah, it's pretty much a pit of snakes. So we should navigate that.
I wonder though, Tian, because I see that, but I think we're going to hit pits of snakes, whatever. But I'm also seeing huge global solidarity at the moment. I mean, every single person I work on decolonial stuff has suddenly become an epidemiologist in just the last few days. It's amazing. And I think if we have a practical story out there to at least guide the discussion, it'll be better than people just picking up on anything. There are going to be people picking holes, vultures, like you say, anyway. But right now, that's a story that people will resonate with, because if they've gone and got the jab themselves, they've had that experience, right? And then to say, well, how would you feel if it was 20 miles away, you had to spend a day and then you didn't know if you're getting it anyway? I think there could be real resonance there, but I hear what you're saying too.
Mm-hmm. And I think, Anand, you know, that's kind of the conversation we started with as we talked about hesitancies, how to deal with that pit of snakes, you know, whether it's about hesitancy or whether it's about Africans, you know, stealing fridges or not having cold chain or not having logistical ability, because that's really the narrative that I'm hearing shift to now, is that, you know, it's not an issue of not having vaccines. They have vaccines, you know, they don't want them, or in some cases they're not able to roll them out. So I think the idea of kind of proactively putting the message out from Africa and dealing with the pit of snakes as they come is a good one. Tian?
Maaza, just thinking in terms of the hesitancy piece, you know, we've been thinking quite a bit about the South African context, and part of our focus, I think, is increasingly turning to government in terms of just the spectacular failure of our governments to communicate around the vaccine programs. You know, in South Africa, you have a bloated fund, Solidarity Fund, that is churning out these really high-level conceptual, you know, pieces of communication, and you just wonder, you know, if you've ever worked in a rural area, you kind of wonder, you know, who is watching these kind of things? I mean, one of the current commercials, for example, says, oh, don't worry about how quickly we got the vaccine, because we got the vaccine quickly because people were dying. And I'm thinking, but how tone deaf do we have to be when with HIV people were dying? So why did we get a vaccine quickly there? So people are just failing, I think, to meet communities at their point of need when it comes to their fears, their anxieties, et cetera, et cetera. So I think we also need to start shining the light on our own government's inability just to engage with society, and their inability to fund civil society, who has been doing this work forever with HIV, with TB, with sexual violence, with white supremacy culture, with all of these things. You know, in South Africa alone, there's at least 12 funding proposals for national, and full disclosure, ours is one of them, sitting in Department of Health for a national communications intervention from village level to national level. But these are not funded, and they're not funded for one main reason. The entire communications line item was stolen. And as a result, our minister had to step aside, and a range of other folks had to step aside. So, you know, at least if government was not doing the work and funding civil society to do it, but now you have nothing, nowhere, you know, in any direction. So yeah, sorry, a bit of a rant. Sorry, Maaza.
That's okay. Thank you. Okay, so I see that we are 1 minute to the end. This has been such a great discussion, and I really appreciate everybody joining at sort of a Zoom heavy end of year time. Any final thoughts before we wrap up? No? Okay, so I will be sharing, I will update the Africa Week of Action document with the additional Rwanda event. I'll send it out. If you have interest in being involved in any way, please, please, please join us. That's starting on the 7th, going forward until about the 18th, I think, Anand, when PV Kenya expects to wrap up. So please join us in that. Keep your eyes peeled for any events. And Marlies, thank you for kicking us off with the All of Health Justice Initiative's activities over the last week with this new variant. I really appreciate all of you joining us. Kapil, it's great to have you for the first time, and Kavengo as well. And hopefully you'll join us again next month. Thank you, everyone.
Yeah, thank you.
Okay.
Thank you.
Bye-bye.
Thanks, everyone.
Thanks, everyone.
Thank you.
Bye.
Bye.